So I always tell my patients when I give them the shingles vaccine to just be ready for potential side effects. You can get pain at the site of the injection. You can get a little bit of redness and swelling. Some people feel a bit fatigued and tired. You might feel a little bit feverish, and some individuals have some stomach upset or some nausea. Most individuals experience nothing at all, and if they do experience something, it's just some mild pain at the site of the injection. After you've had the shingles vaccine, you want to definitely rest. You don't want to do anything vigorous that day. Most people don't need to. They don't need to change anything significantly, but we definitely don't recommend doing a lot of heavy or intensive sports or other activities after you've had your shingles or any vaccine. You want to take some acetaminophen to help with the feeling of pain or the slight fever that some individuals may get. And if you're able, and if you get any redness or if you have any soreness at the site, you want to ice it. That'll also help some individuals as well. If you're feeling nauseated after you've had the shingles vaccine, you can definitely avoid having certain intensive foods that can make the nausea worse. So absolutely avoid alcohol. Some people avoid dairy because having dairy can actually make you feel a little bit worse. And so a bland diet can often be helpful. And symptoms shouldn't be super intense, but if they are, your doctor can give you a little bit of medicine to help with the nausea as well. So some individuals, and very, very few, will have more severe reactions to the shingles vaccine. And what you are basically looking for is signs of an allergic reaction to the vaccine. And those may be difficulty breathing, a rash all over your body that's progressively worse, itchiness. In that case, you should call your primary care doctor or call a medical facility right away to get checked out. And especially if you're having symptoms of anaphylaxis, God forbid, or throat closing, you want to head right to the emergency department so that they can make sure that they can administer medications and treatments to you. Some individuals may also experience a rare complication of vaccines called Guillain-Barré. These symptoms may include weakness, difficulties with moving your bowels or your bladder, worsening fatigue, and inability to move. I want to emphasize that this reaction is very, very, very rare, but it's not something that we see very often, but you should be aware of the signs so you can get help if you're at all concerned. So despite the possibility of having side effects and despite these rare complications like the allergic reactions or Guillain-Barré, shingles is one of the safest vaccines that we have, and it's absolutely worth individuals talking to their doctors about getting the shingles vaccine. It is a condition that we don't want individuals to get if they can avoid it, and if you're eligible, getting the vaccine from your doctor can keep you safe and protected and can keep you healthy.